Okay, so our third topic on topic 1 is about postpartum complications. These are the different complications that we'll be discussing: postpartum hemorrhage, thrombophlebitis, subinvolution, postpartum infection, mastitis, and emotional complications. You will see in the photo in the box the different assessment findings when checking for complications in a postpartum woman. And these are elevated temperature, pallor, there is pain and swelling of the breast, the uterus is relaxed and not firm, hemorrhage, abdominal pain, pain in the area of the symphysis pubis, especially when walking, the lochia with a very foul odor, and perineal pain. There are different feelings, emotional feelings of extreme sadness, or the mentation is not in contact with reality, thready and rapid weak pulse, decreased blood pressure, and as well as pain, tenderness in the leg, and a positive Homan sign. So all of these we will be discussing as we explain the different postpartum complications one by one. Postpartum hemorrhage is the most serious complication and it's the leading cause of maternal mortality. It's defined as any blood loss from the uterus that is greater than 500 ml within 24 hours after vaginal birth. In some institutions, they regard postpartum hemorrhage as more than 1,000 ml. In box 25.3, you can see the different conditions that increases a woman's risk for postpartum hemorrhage. And these are conditions that distend the uterus beyond what is its capacity. These are also conditions that cause lacerations of the cervix or uterus. Conditions are relating to abnormalities of the placental site or its attachment. Conditions that leave the uterus unable to contract readily after birth. And lastly, the conditions that cause inadequate blood coagulation. There are several causes of postpartum hemorrhage. Uterine atony and lacerations are the early causes of early postpartum hemorrhage, while retained placental fragments is the usual cause of late postpartum hemorrhage. When we say early postpartum hemorrhage, it's during the fourth stage of labor. So, yung oras right after placental delivery until 4 to 6 hours after birth, na-determine mo na merong hemorrhage. Meaning, excess yung bleeding more than the normal. So, sa early postpartum hemorrhage, again, uterine atony or lacerations ang cause. Pag sinabi namang late postpartum hemorrhage, minsan nakauwi na yung mommy or madalas nakauwi na yung mommy from the hospital after giving birth. No, sometimes it takes days, weeks, or even months na nagkakaroon siya ng hemorrhage. Ibig sabihin, normal naman yung pagdurugo nung mga unang araw o nung oras ng panganganak at pagkapanganak, pero ilang araw, ilang linggo o ilang buwan, biglang nagkaroon ng biglang excessive bleeding or hemorrhage. So, si late postpartum hemorrhage, usual cause niya, retained placental fragments. The others, placenta accreta, uterine inversion, and DIC or disseminated intravascular coagulation. Now, we discuss each of these causes one by one. First is uterine atony. It's the loss of muscle tone resulting to relaxation of uterus. In the photo, we can see dun sa taas na part, normal postpartum, kailangan contracted ang uterus. Yan ang number one reason kung bakit merong active management of the third stage of labor. At sa active management of the third stage of labor, isa doon ang pagbibigay ng oxytocin right after the birth of the baby to make sure that the uterus remains contracted in the postpartum period. So if it is contracted, you will see in the photo na masyadong masikip yung space para magkaroon ng daloy ng maraming dugo. Unlike in the lower photo, uterine atony allows hemorrhage to flow into the uterus. Again, uterus must remain contracted after birth. This is to keep the open vessels from the placental site from too much bleeding. Hindi natin goal na walang bleeding because there is normal bleeding after birth dahil nagkaroon ng detachment ng placenta from the normal site. Pero it should not become excessive. Yun yung ayaw natin. And to make sure that it doesn't bleed excessively, uterine must remain contracted and prevent uterine atony. Now, what are the reasons or the causes of uterine atony? It could be because there is overdistension, meaning sobrang laki ng paglaki ng uterus ni mommy, probably because of a very big baby or multiple pregnancies. Over-massage, that's why we do not over-massage. Massage lang normally, no, as recommended during the active management of the third stage of labor. Maternal exhaustion, masyado siyang napagod, masyadong nahirapan doon sa labor and delivery. Kaya dapat well-prepared ang panganganak at isa doon para ma-prevent yung too much exhaustion yung regular prenatal exercises. And lastly is inhalation anesthesia with the effect ng mga anesthetics given to the mother. How do we assess postpartum hemorrhage, especially when we are relating about uterine atony as a sign of early postpartum hemorrhage? Talaga namang merong bleeding right after birth. It's actually difficult to estimate, but be keen with sudden gush of blood, seepage of blood, so biglang bumubulwak yung dugo, saturated perineal pads, no? Lalo na kapag ang bilis na mapuno, 25 to 50 ml i-weigh, no? Usually 1 gram is to 1 ml. So dapat hindi excessive ang expected natin sa normal vaginal delivery, no, na blood loss ay nasa 500 ml. Pero kapag CS, mas madami siya, umaabot ng 1,000. Also, importante din na yung posisyon ng nanay postpartum ay nasa side or side lying because a supine position will allow pooling of blood na ipon doon sa medyo part na ilalim ng vaginal opening ni mommy, yung dugo. Kaya hindi pala siya lumabas. So, magugulat ka na lang na pag nag-change siya ng position, biglang magkakaroon ng dugo. Yun pala, nag-pool kasi yung blood from a supine position. So, better na nag-change siya ng position regularly or a side-lying position. Next, titignan mo rin, dapat ang uterus firm. And the lochia, you also check the lochia. Definitely, kapag malambot ang uterus, tapos ang dami mong napapansing dugong lumalabas, that is a possibly uterine atony. What is the therapeutic management? First is to do uterine massage. Again, yan ang immediate management. Pinakamabilis kapag na-determine mo na uterine atony nga. Okay? Pero tatandaan na ang early postpartum hemorrhage ay maaaring laceration din ang cause. So, pag na-identify mo na may early postpartum hemorrhage, your goal is to stop bleeding. But determine first the cause so that you can stop the bleeding. If it is atony, malambot yung uterus, do uterine massage as the first nursing action. Second is to administer meds. Oxytocin via IV infusion. You can give additional 10 to 40 units in 1 liter of D5LR or lactated ringer solution. 1 hour short duration of action lang siya, pero effective siya to readily contract the uterus. Second drug is carboprostromethamine or Hemabate. It's given as an IM. This is a prostaglandin derivative. Pwede siyang ibigay every 15 to 90 minutes until 8 doses. And again, if it's a prostaglandin derivative, nag-i-initiate siya ng uterine contraction. Yun nga lang, prostaglandins cause diarrhea. So we have to check that as a side effect. Third is methylargonovine maleate or methergine. It's also given IM. It's an ergot compound. It can be given 2 to 4 hours, every 2 to 4 hours until 5 doses. Mabilis din ang long-term ang duration of action ng methergine. Isa sa common na adverse effect niya, it significantly increases the blood pressure. Kaya cautiously give these to mothers with hypertension and always check the blood pressure when giving this, similar with oxytocin. And the last is misoprostol, rectal. It's also a prostaglandin analog that will stimulate uterine contractions. Again, dahil prostaglandin siya, it can also cause diarrhea. Third is to assure that the bladder is always empty. Remember that a full bladder will prevent the uterus to contract fully. So kung ang mother ay walang bladder sensation, best to result sa pag-insert ng Foley catheter. Pero if not naman, just assist the mother to empty the bladder. Fourth, you can give oxygen via face mask 4 liters per minute if there are signs of respiratory distress, lalo na pag marami nang nawawalang blood sa kanya. Position supine, and this will allow now adequate blood flow to the brain and kidneys for better perfusion. 6, pwede kayong mag-administer or mag-perform ng bimanual massage if this is also with retained placental fragments. Okay? Again, si retained placental fragments ay usual cause ng late postpartum hemorrhage, pero kapag may nakita na retained placental fragments early in pregnancy, you can immediately extract it manually. 7, assess for possible blood transfusion, the need for the blood giving of blood, so check the donor, blood type, the RH is very important, compatibility ng blood, and the like. And last, prepare for possible hysterectomy kung yun yung last resort to prevent further hemorrhage, or suturing kung meron man nung cervical lacerations. Next is laceration. Lacerations are tears of the birth canal. It occur most often because there's a difficult or precipitate birth in primigravida, with the birth of a large infant, or with the use of lithotomy position and instruments for delivery. There are 3 usual types of laceration: cervical laceration, vaginal laceration, and perineal laceration. So let us discuss them one by one. Cervical laceration is usually found on the sides of the cervix. It's very near the branches of the uterine artery. If an artery is torn, there are blood gushes that are bright red than venous blood in uterine atony. So, mas mapapansin natin na as an early postpartum hemorrhage, yung dugo na medyo bright red ay posibleng arterial cervical laceration compared sa hindi ganun ka-bright na venous blood kapag ang cause ng early postpartum hemorrhage niya ay uterine atony. Okay? Now, repair is difficult and extensive. Sometimes may need regional anesthesia kasi, as you know, the cervix is already a part of the uterus. It's the opening of the uterus. So, internal reproductive organ yung tinatahi. That's why it's difficult and extensive. To relax uterine muscles and prevent pain, kaya ibinibigay ang regional anesthesia. Next is vaginal laceration. This is rare but easier to assess than cervical laceration kasi mas kitang-kita mo na yung laceration sa vagina, it's easier to view. Since vagina is friable, there may be oozing after repair. Kaya pag natahi na yung vaginal laceration, kailangan nilalagyan ng vaginal packing. Ini-insertan ng packages, no? Pwedeng mga gauze doon sa loob ng vagina. This is to maintain pressure on the suture line. It is removed usually in 24 to 48 hours. But remember, packing causes pressure on the urethra and it can interfere with voiding. So minsan, kahit na vaginal delivery siya, postpartum, nagkaroon ng vaginal laceration, pwedeng insertan ng Foley catheter to assist in the urination. And lastly is perineal laceration. Nabanggit nga kanina, lithotomy position increases tension on the perineum. Kaya nape-prevent sana ang perineal laceration kung sinusunod ang protocol ng EINC na wala ng lithotomy position during birth. There are several classifications of laceration. Pag first degree, vaginal mucous membrane and skin. Second degree, umaabot hanggang skin fascia, muscle. And third degree, hanggang external sphincter ng rectum. Fourth degree, hanggang rectal sphincter mismo and mucous membrane ng rectum. We have already discussed before during the normal delivery during MCN1 that ang first degree laceration ay maaaring hindi na tinatahi. Kusa siyang naghihilom. Ang importante lang ay ang within the first 24 hours, yun yung cold compress to prevent pain, edema, and as a management. Pero after 24 hours, yun naman yung warm compress, vasodilation for faster healing. But definitely, pag second, third, and fourth degree laceration, kailangan ng suturing. Sa third and fourth degree laceration din, dahil kasama or involve yung rectum, always assess for problems related to defecation. Ganun din ang pag-ire, iwasan yung straining. Okay, therefore, you have to do all the interventions to prevent that there is straining dahil yung tahi baka mapunit kapag may pag-ire na nangyari. At dahil sugat ito, check for the RIDA signs, check na hindi magkakaroon ng further risk, lalo na yung infection, because your goal is for the wound to heal fast. So, sa dalawang na-discuss natin na causes ng postpartum hemorrhage, which is early postpartum hemorrhage, pag atony, na-check mo na atony siya, immediately massage, then oxytocin. Pero pag laceration, you have to immediately do the suturing. Third is retained placental fragments. Again, nabanggit ko na that it is the usual cause of late postpartum hemorrhage. It's the incomplete expulsion of placenta. These will keep the uterus from contracting fully. So there is abnormal bleeding or abnormal bleeding occurs. To check, importante na dapat ini-inspect ang placental completeness after birth. Check for the completeness of its cotyledon. Hindi importanteng ma-determine mo na ito ba ay Duncan or Schultz. Ang importante, walang punit yung placenta after its birth. You can also check for ultrasound or baka dun sa blood sample niya, lalo na dun sa uterus, meron pang HCG doon sa blood. No? Bleeding from retained placenta may be detected 6 to 10 days postpartum. At delikado yon sa mommy, hindi lang dahil doon sa risk ng hemorrhage kasi dahil may nabubulok na placenta doon, meron pa siyang risk of infection. Now, of course, if there is a retained placental fragment, the attempt to clear the retained placenta should be done immediately. Maaaring manual removal through bimanual exam as shown in the lower left photo. So, kukuhanin manually yung naiwan, or you can also do dilatation and curettage para makuha using an equipment yung mga naiwan na placenta sa loob ng uterus. Sometimes, pwedeng bigyan si mommy ng prophylactic antibiotic because, again, as mentioned, there is a risk of infection, especially of endometritis. Another cause of postpartum hemorrhage is possibly placenta accreta. This is rare, but it is the penetration of the myometrium by the trophoblast resulting in abnormal adherence of the placenta to the uterine wall. There are 3 layers of the uterus: the perimetrium, the myometrium, and the endometrium. We know very well that only the endometrium is capable of shedding off. Kaya nga monthly, pag kumakapal yan, nagsha-shed off, merong menstrual flow. That's why yung placenta is only capable of attaching to the endometrium so that when birth occurs, it detaches normally. Sa endometrium lang kasi siya naka-attach. Now, in placenta accreta, sumobra yung penetration ng placenta. Umabot siya hanggang myometrium. And the myometrium is not capable of shedding off. Hindi ganun-ganun kadaling ma-detach. That's why this is a very difficult complication. May mga mas delikado pa, placenta increta, umabot ng perimetrium, and yung placenta percreta, even in the bladder, nag-attach siya. Okay? In this kind of condition, maaari siyang mag-cause ng retained placental fragment, definitely, dahil hindi nga totally madedetach ang placenta. No? The drug, methotrexate, which is a chemotherapy drug, as we know from pharmacology, may help destroy retained placental tissue. Pero minsan, may mga ginagawa pang additional intervention, and that is through balloon occlusion and embolization of internal iliac arteries. That is to stop the bleeding and prevent hemorrhage also. Okay? Now, sa mga last resort, ang placenta accreta, there is no choice but to perform hysterectomy. Hysterectomy or removal of the entire placenta. At minsan, even tabso. TAHBSO, total abdominal hysterectomy, and bilateral salpingo-oophorectomy. Hindi lang uterus ang tinanggal, pati yung dalawang fallopian tube and dalawang ovary. Hysterectomy, no, which is total abdominal hysterectomy, bilateral salpingo-oophorectomy. Salpingo is fallopian tube and the oophorectomy is removal of the ovary. Another is uterine inversion. In the photo, you will see that the uterine fundus has inverted. No? It's the prolapse of the fundus of the uterus through the cervix. Kaya si uterus nag-turn siya inside out. Definitely, there's a large amount of blood that gushes from the vagina. And here, the fundus is not palpable kasi kita mo talaga na lumabas yung uterus. Okay? Uterine inversions management is to replace the fundus manually. You can see in the photo how it's being done. It looks easy, but it's not that easy to do that. General anesthesia is needed. Initially, a nitroglycerin or a tocolytic is important, and that will relax the uterus. In this case, a relaxed uterus is needed because you cannot put back inside a contracted uterus. So, it will replace the fundus manually. Kaya dapat mabilis siyang gagawin because if the uterus is relaxed, still tuloy-tuloy ang pagdurugo. Right after replacement, oxytocin is now given. This will now allow contraction of the uterus and that will remain the uterus in its natural place. Since you know very well the endometrium was exposed, lumabas siya, lumuwa siya ng pabaliktad. You have to give prophylactic antibiotic. And also, no, in future pregnancy, maaari ulit itong mangyari. At minsan, nire-require o nire-recommend na CS na in future pregnancy to prevent repeat inversion kasi maaari ulit siyang mangyari. Next is disseminated intravascular coagulation. So this complication is a complication of a complication. Ibig sabihin, nagkakaroon ng DIC kasi may previous problem na nangyari at nagkaroon ng another complication. Now, pag sinabi natin disseminated, no, yung buong circulation sa loob ng blood vessel, nagkakaroon ng abnormal clotting. We mentioned before that tumataas talaga ang clotting factors ng babaeng buntis because na-anticipate niya na pag nanganak may normal bleeding and something or someone should stop that bleeding para ma-prevent ang hemorrhage. Dito, abnormal yung pag-activate ng clotting factors niya. And for us to understand better, let us try to understand also ano ba yung normal blood clotting. First, kung merong blood vessel injury, platelets will seal over a point of bleeding. And the platelet, together with the intrinsic and extrinsic clotting pathways, will activate and further strengthen the platelet plug. This is through the fibrin threads, kaya nagkakaroon ng firm and fixed structure. Therefore, nagsastop yung bleeding. Ito yung initial attempt ng body to stop bleeding, which we call hemostasis. Now, yung clotting na yan, kailangan may nagkokontrol sa kanya. To prevent too much clotting, thrombin activates fibrinolysin. It's a proteolytic enzyme to digest excess fibrin threads through anticoagulation, which release fibrin degradation products. Kasi enough na yung na-activate na platelet, clot, and fibrin. So, dapat hindi na magtuloy-tuloy yung clotting. In DIC, what happens? Dito, nagkakaroon ng acquired disorder of blood clotting kasi yung fibrinogen, it falls below effective limits. At dahil doon, nagkukos ng early symptoms of easy bruising and bleeding from IV sites. So, nagkakaroon ng maliliit na clots all throughout the blood vessel, and those clots actually consume the other clotting factors. So, wala nang ibang nagpapaklot kasi na-consume na siya lahat doon sa loob ng blood vessel. That's why minsan meron kang mga previous injection sites na makikita mo biglang nagkaroon ng oozing blood. It's a sign of DIC. The extreme bleeding causes platelets and fibrin from the general circulation to rush to the site that not enough are left in the rest of the body. So dito, ang DIC, maaari siyang mag-result sa mga previous bleeding or blood vessel problems such as abruptio placenta, yung na-discuss natin na pregnancy-induced hypertension, amniotic fluid embolism, retained placenta, nagkaroon ng sepsis, no, from septic abortion, o kaya may dead fetus sa loob na na-retain or it could be a missed abortion. So lahat ng yon pwedeng matrigger yung DIC. That's why I mentioned a while ago that DIC is another complication of a complication. Now, dahil nga, in general or as a summary, wala na kasing effective na nagpapaklot dun sa other sites of the body. No? Kaya DIC results in a paradox. At one point in the circulation, there is increased coagulation. Na-consume na niya lahat, pero dun lang sa body part na yon. But throughout the rest of the system, bleeding defect exists. Ano ang definitive diagnosis for postpartum hemorrhage? So these are the definitive diagnosis. Platelet less or equal to 100,000 microliters. The prothrombin is low. Depends on conversion of fibrinogen to fibrin. Thrombin is elevated. This measures the time of conversion of fibrinogen to fibrin. Yung fibrinogen mababa, no, below 150 mg per deciliter. The fibrin split products more than 40 micrograms per ml. This reflects destruction of fibrinogen or fibrin. Plus, yung D-dimer is abnormal. So, ito yung nagdedetermine ng specific fibrin degradation products. Now, sa isang test tube, pwede rin natin yung ma-check. No? Easy. In a test tube, you put a small amount of blood. After 30 minutes, a clot should not only form, but retract. And yung volume ng serum dun sa tube should exceed the size of the clot. If it does not occur, then low fibrinogen is suggested. So, pwede siyang ma-detect doon, but again, na-mention ko dito, ito yung mga definitive diagnosis. What is the management? DIC must be intervened right away. Halt the underlying insult. Kung ang dahilan abruptio placenta, kung ang dahilan pregnancy-induced hypertension, kung ang dahilan may sepsis, the initial solution is to stop the initial problem. Second, stop the marked coagulation so that coagulation factors can be freed. Pwedeng ibigay ang IV heparin to halt the clotting cascade. So what will the IV heparin do? This will this will halt the clotting by releasing coagulation factors. Coagulation now can be restored throughout the rest of the body. Third is to restore normal clotting function. So ano yung pwede nating ibigay? Pwede kang magbigay ng blood transfusion, fresh frozen plasma, platelet, antithrombin-3 factor, fibrinogen, cryoprecipitate. Lahat ng yon pwedeng mag-restore ng clotting factors. To summarize assessment considerations when there is postpartum hemorrhage, first, if you are suspecting may hemorrhage, if you palpate and the uterus is soft or boggy, relax atony. So do the interventions to manage atony. If firm, pero may excess bleeding pa rin, malamang laceration. So suture immediately. Second, yung kulay ng clots, pag bumubulwak, large amount, malamang atony. Pero pag patak-patak yung dugo, laceration. Onset ng hemorrhage, pag immediately after delivery, either atony or laceration. Pero pag retained placental fragments may take days or weeks. With severe blood loss, ayaw natin ng shock, so go back to the ways to prevent and manage hypovolemic shock. And lastly, consider also, baka kaya nagkakaroon ng hemorrhage kasi full ang bladder. Again, a full bladder may displace uterus and prevent it from contracting firmly. Another complication is thrombophlebitis. It's the inflammation of the lining of the blood vessel with formation of blood clots. Kanina nabanggit natin ang DIC. Ang DIC, maliliit na clots that does not occlude the blood vessel. But in thrombophlebitis, these are large clots which occlude blood vessels. Okay? So, meron siyang tatlong klase, femoral, pelvic, or pulmonary embolus. Thrombophlebitis may be the result of an injury, any injury that may trigger the blood to clot and occlude a blood vessel. Second is because of an infection, especially an endometrial infection that triggers clotting. And third, there's a normal increase in circulating clotting factors during pregnancy, as mentioned earlier. Ang babaeng buntis, talagang tumataas yung clotting factor niya kasi nga, ina-anticipate niya na may bleeding during birth, so iko-control yon ng clotting factors during birth. Pero dito, abnormal yung pagkakaklot. In femoral thrombophlebitis, you can see there is pain, edema, and redness over the leg. Madalas siya, syempre, sa right or left, makikita mo sa popliteal area. There's an elevated temperature and chills. Yung peripheral pulses may be decreased, so definitely dito, sa picture, you can expect na yung right popliteal pulse is possibly weak, And also, tingnan mo rin, yung mas malala yung pulses, the distal pulses, mas delikado na yon na baka wala nang napupuntang blood flow. So you can expect that the right dorsalis pedis and right posterior tibialis, baka hindi lang siya weak pulse, baka absent pulse na siya. Ganon din, baka cold to touch na yung area na yon. Pero kung titignan mo naman yung right inguinal, baka okay pa siya. Kasi dun sa upper part, the right inguinal pulse, wala pa naman doon yung clot. So, nag-uumpisa yung affected from the site of injury, which is femoral, nagiging weak, hanggang mapunta ka dun sa distal, dun sa bandang paa o talampakan, dun man makakita ng cool, pale leg, or even absent pulses. Also, posible ang positive Homan sign. But again, Homan sign is pain upon dorsiflexion of the foot. Pero pain is relative. Maaring may babae na mataas yung pain sensation kahit ipagawa mo sa kanya yung dorsiflexion of the foot at may thrombophlebitis siya, baka hindi niya nararamdamang masakit. So, hindi siya definitive sign, but it could help you in detecting femoral thrombophlebitis. Next is pelvic thrombophlebitis. Here, there is a chance that the woman feels extremely ill. Mataas ang lagnat niya, chills, and general malaise. This usually follows mild endometritis and occurs later than femoral thrombophlebitis, usually around 14th or 15th day puerperium. Last is pulmonary embolism. Ito ang pinakadelikado. It occurs as a complication of the thrombophlebitis, any of the earlier two mentioned. Kasi dito, may sudden sharp chest pain, tachypnea, tachycardia, or orthopnea and cyanosis. Dahil umabot na yung thrombus na naging emboli at bumara siya doon sa mas maliit na blood vessels ng ating cardiopulmonary system. For the nursing interventions, it's important to maintain bed rest with leg elevated on pillow. It's necessary to consider that you never raise a knee gatch. Yung knee gatch, siya yung mechanism ng isang bed na nabebend yung part ng knee. Do not do that with thrombophlebitis because our concern is to always make sure that there is enough venous return going to the heart. At kapag nakabend yung part ng knee, nagkakaroon ng blockage or hindi enough yung venous return going back to the heart. Second is to apply moist heat as ordered. Moist heat will allow vasodilation and this is for a better blood flow. Administer analgesics or antibiotics as needed and as ordered. And you know the indications of these drugs already. Fourth is to provide bed cradle to keep sheets off the leg. Yung bed cradle, sinisiguro niya na kahit mag-move yung patient sa bed, hindi umiikot yung linen or yung kumot doon sa leg niya. Kasi pag umiikot yung linen doon sa leg, syempre, madadagdagan lang yung occlusion doon sa blood flow sa legs. Fifth, you administer now the drugs which are anticoagulants such as heparin or thrombolytics such as streptokinase or urokinase. Of course, when you give this drug, inaalis mo yung clot at piniprevent mo ang further clot. And when you give these drugs, mas nagtithin yung blood. Therefore, you have to observe client for signs of any bleeding. And there are needed antidotes kung meron mang bleeding. 6 is to apply elastic support hose if ordered. So, yung mga thromboembolic stockings. Itong mga stockings na ito will allow better blood flow dun sa lower extremities, kaya hindi nagkakaroon ng clotting. Importante ang daily inspection of the legs. Kapag merong elastic support hose, baka naman minsan sobrang naiipit na pala yung blood flow. And syempre, tinatanggal every now and then yung thromboembolic stockings or the hose. Teach client not to massage the legs. If there is pain, which is very common in thrombophlebitis, isa sa mga important interventions yung massage. Pero with thrombophlebitis, do not massage legs. Kapag may thrombus at minasage mo yan, eventually yung patient mararamdaman niya yung relief from pain. Kasi maaaring nag-breakdown yung thrombus, pero nag-breakdown lang siya. Hindi siya natunaw. Kung nag-breakdown siya, lumiit yung thrombus, naging emboli. Kaya nawala yung pain. Pero si emboli, magta-travel yan going through the circulation. At pag umabot siya doon sa cardiopulmonary system, no, lalo na sa may bandang chest area, baka magkaroon ng further complication, which is a pulmonary emboli. Next, allow client to express fears and reactions to the condition. So let the patient verbalize, and the nurse is there, of course, to listen. Observe client for signs of pulmonary embolism kasi ito yung pinakadelikado sa lahat that would probably require intensive care. And lastly, continue to bring the baby to mother for feeding and interaction. Pwede pa rin ang mother-infant bonding. Just always make sure that we never regret, no, or we never take into we always take into consideration yung exclusive breastfeeding because that is still allowed with this mother. Next complication is subinvolution. Subinvolution is the failure of the uterus to revert to the pre-pregnant size and shape through gradual reduction in size and placement. We have learned previously the concept of involution. At yung involution ay ang pagbalik ng reproductive organs, especially ng uterus, na may pinakamalaking change during pregnancy. So babalik siya, involution, yung pagbalik niya, to the non-pregnant state. Because before, no, naging 1,000-gram organ ang uterus. Pero babalik siya to a 50-gram organ na umakyat from the symphysis pubis na umabot halos doon sa bandang rib cage nung buntis, pero dapat babalik to the pre-pregnant state na just beneath the symphysis pubis. Now, remember how to check if there is normal subinvolution or normal involution, no? So, paano i-check yon? Una, dapat yung fundus ng uterus bumababa 1 finger breadth every day or 1 cm every day postpartum. On the day of postpartum, maaaring nandoon siya sa level ng umbilicus or above. Pero 1 day postpartum, baba siya ng baba. No? 1 cm or 1 finger breadth. And then hanggang sa hindi mo na siya makapa by 1 week or 7 to 10 days. Pero hindi ibig sabihin na tapos na ang involution. No? It would usually require 4 to 6 weeks para masabi natin na back to normal na ang uterus. Okay? Dapat firm din siya para maging enough ang involution, which means enough uterine contraction is needed for involution. So when subinvolution happens, hindi mo makikita yung normal na pagbaba ng fundus plus hindi siya well contracted. Ano yung usual causes ng subinvolution? It could be because there's an infection, especially yung infection ng endometrium. Posibleng dahil sa maraming risk factors such as premature rupture of membrane. Okay? Pangalawa, baka may retained placental fragments. Therefore, pwedeng magkaroon din ng further infection pa. And pangatlo, yung mga tumors in the uterus such as baka may myoma si mommy and other possible neoplasias there. Okay? As an assessment, no, at 4 or 6 week postpartum visit, mapansin mo parang uterus is still enlarged. Ibig sabihin, baka nakakapama pa rin yung fundus, dapat wala na yon. Or soft si uterus, or yung lochia is still present, o kaya posibleng si lochia hindi yung normal na sequence niya from rubra, the first 3 days, serosa, kailan siya, hanggang maging alba, so hindi normal yung sequence. The management is, again, ang dahilan bakit merong subinvolution, malamang hindi enough uterine contraction. Kaya magbibigay ng gamot that is very effective for uterine contraction, pero nabanggit natin before, it can really cause a spike in the blood pressure, so check very well BP. Methergine or methylargonofin maleate, you can give it per orem, 0.2 milligrams QID. This will definitely improve uterine tone and this will complete the involution. Pangalawa, huwag kakalimutang magbigay ng antibiotics, especially kung ang cause niya ay endometritis. Kasi hanggat hindi natitreat yung infection, baka hindi maging enough yung involution pa rin. Postpartum infection, as previously mentioned, is any infection of the reproductive tract associated with giving birth, usually occurring within 10 days of the birth. Yung infection may be localized, meaning doon sa reproductive organs, or systemic, lalo na pag naging septic infection na siya or involving the other body parts. Box 25.5 will tell us the different conditions that increase a woman's risk for postpartum infection. And these are yung mga previous complications din, such as rupture of membrane, may naiwang placenta, nag-hemorrhage kasi humihina yung kondisyon ng babae, meron siyang pre-existing blood condition such as anemia, nahirapan siyang mag-labor, dystocia, and then si fetal heart rate, nagkaroon ng mga problems, or mismong may mga vaginal infection, and other possible conditions of the uterus. Ano yung mga possible infections na binabanggit natin? First is endometritis, next is perineal infection, and third is peritonitis. So si endometritis, in the first photo above, is the infection or inflammation of the endometrium or the innermost lining of the uterus. This is of great concern kasi yung pagkakaroon ng scarring, no, dahil nagkaroon siya ng infection sa endometrium, will possibly lead to interference with future pregnancy. Kaya kailangan ma-manage talaga siya. Second is perineal infection. Obviously, ito ay dahil may infection sa perineal area, lalo na kung may mga sugat dito. Merong episiotomy or laceration. Please go back to the concepts of laceration and episiotomy. Siyempre, sa ganon, no, lagi nating tatandaan na panatiliing tuyo, malinis yung sugat at dapat mabilis siyang mag-heal. Kaya nga kailangan may tulong ng peri-light or perineal light. Pag ganito, usually localized infection siya. Yung peritonitis on the other hand, no, the lowermost photo already involve the other organs or the peritoneum. No? Ito yung membrane na nagko-cover ng ating mga abdominal contents, including the reproductive organs. This may occur as an extension of endometritis, as infection spreads through the lymphatic system or directly through fallopian tubes or uterine wall to the peritoneal cavity. Initially, ang sign niyan, rigid abdomen, parang naninigas. And this interferes also with future pregnancy too. Kasi nga nagkakaroon din ng scarring and adhesions in the peritoneum, and we know that the reproductive organs are also there. Assessment findings. So, nilalagnat 38 degrees or more, usually for 2 consecutive days. Again, remember the concept of excluding the first 24 hours. Kasi normal sa babae, first 24 hours postpartum, mataas yung temp, kasi meron siyang dehydration, no? Kakatapos lang niyang manganak. That's why you have to check for other possible signs of infection, except using temperature as a sign, no? Kung gusto mo agad ma-anticipate na baka may posible siyang infection, first 24 hours pa lang. Next, abdominal, perineal, or pelvic pain, foul-smelling vaginal discharge, lalo na kung wala naman ng lochia. Chills or Malay, general body weakness, rapid pulse and rapid respirations, plus yung elevated WBC. Again, si elevated WBC ay posibleng mataas talaga first 24 hours. So, exclude that finding. Of course, pinaka-definitive determine ka ng positive culture or sensitivity test, meaning doon sa mga discharges na lumalabas ay nag-check ka nung mismong causative organism na nag-cause ng infection. Nursing interventions. Force fluids. Importante, client may need more than 3 liters per day. Initially, this will also combat the fever. Second is administer medications as ordered. Ano ba yung mga pwede nating ibigay? Clindamycin as an antibiotic is good. No? Second, yung methergine. Dahil nabanggit natin kanina, yung infection ay pwedeng mag-cause ng subinvolution. So, pwede kang magbigay na ng methergine or methylorgonovin maleate. Third, you can give also analgesics kasi nga posibleng may pain na nararamdaman si mommy. Third is to position client in Fowler's or allow walking to promote drainage and prevent reflux of the infection into the higher reproductive organs or higher reproductive tract. This encourages lochia drainage by gravity and again, nape-prevent yung pooling ng infected secretions. Fourth is a warm sitz bath. Of course, this will cleanse the area and provide comfort. Pwede din na magbigay ng warm compress. Fifth is a promote perineal hygiene. Importante to change perineal pads at yung pagtuturo kay mommy, wiping from the back to front. Six is to encourage a high-protein diet. Of course, this will promote faster tissue healing. And kung may peritonitis naman, may insert NGT to prevent vomiting and rest the bowel. Peritonitis kasi is often accompanied by a paralytic ileus. So, importante na pagpahingahin muna yung GI tract, kaya ang pagkain also ay through the nasogastric tube. Mastitis is another postpartum complication. It's the infection of the breast, usually unilateral, and its frequent cause is because of a cracked and fissured nipples in a nursing mother. Causative organism, usually Staphylococcus aureus. So, ang mommy, importante na health teaching, pag nagbe-breastfeeding, ay laging nililinis yung breast area. Before and after breastfeeding, water lang syempre yung gagamitin. Hindi gagamit ng sabon. Kasi yung sabon, pag lagi mong ginagamit before and after breastfeeding, dahil more of alkaline ito, maaari siyang mag-dry ng skin. Hindi mo naman pwedeng lagyan ng lotion ang breast kasi dito nagsasak si baby. And kapag dry ang skin ng breast, mas madali siyang mag-crack and fissured, lalo na pag hindi mo lililinis, kasi may mga milk discharges. Ngayon, yung paggamit ng sabon ay hindi naman natin yan contraindicated. Pwede pa rin gumamit syempre ng sabon sa paliligo sa breast pag nagte-take a bath. Pero yung before and after breastfeeding, kailangan nililinis lang siya with water. If untreated, this may result in breast abscess at kawawa naman yung baby. Siyempre, hindi siya makakapag-exclusive breastfeeding. Tapos, yung mommy din, this is very painful for a woman. Kaya nga yung symptoms niya, bukod sa pain, swelling, redness, fever, enlargement, change nipple sensation, may mga abnormal discharges aside from the milk, itching, again, yung tenderness pag pinalpate, at minsan may breast lump. Mastitis may occur from day 7 postpartum until the baby is months old. Kasi nga ito ay posibleng dahil sa pagkakaroon ng mga crack or fissure doon sa nipples. Again, no, bukod sa painful, swollen, red breast, no, maaring may fever si mommy, yung breast milk din niya ay nagiging scant. Mas kumukonti ang production ng milk. Nursing interventions, no, in the photo, you will see that it's really reddened. It's a sign of infection. Nawala yung kulay ng areola na dapat darken. Okay? It's important to teach hand washing, syempre lalo na before touching the client's breasts. Syempre, we follow the universal precaution. Second is to administer antibiotics as ordered. Yung mga penicillin-resistant anti-staphylococcal drugs. Recalling your pharmacology, you can give dicloxacillin or cephalosporin. Pwede rin. Yung effect niya usually in 3 days. No? Third is to apply cold or ice compress and wear good supportive bra. Pwede siyang i-alternate with warm, wet compress. These can help with pain relief and these can reduce inflammation and edema. Importante din na kahit hindi nakakapag-breastfeed yung baby sa breast na ito, in-empty pa rin yung breast regularly. Discontinue breastfeeding kasi baka mahawa si baby, pero empty the breast regularly because a breast emptied of milk prevents further growth of bacteria at baka lalo lang mag-cause ng further infection kung hindi ini-empty yung breast. The last of the complications is on emotional complications. Actually, we have discussed this previously in your MCN1. Postpartum blues, postpartum depression, and postpartum psychosis. Ang postpartum blues ay expected or normal kasi biglang may sudden drop in the hormones of a mother nung pagkapanganak niya. Pero hindi porket expected or normal ang postpartum blues ay pababayaan siya. We have to give support, empathy, offer compassion, and understanding. Siyempre, the best support person is the husband, including the family. Yung masyadong malungkot yung pakiramdam ng nanay, meron siyang fears, tapos iyak siya ng iyak. So, ito ay posibleng dahil sa postpartum blues. Ngayon, pag nagkaroon ng complication, ito yung depression and psychosis. With depression, remember the signs that we have mentioned before. And then, pag psychosis, ito na yung may kasamang delusions or hallucinations, meaning yung 5 senses, they are not real already. Okay? Ang dahilan ng mga ito ay dahil nga posibleng napabayaan yung postpartum blues o kaya dati na sila talagang may depression or psychosis na trigger. And of course, lack of social support. Therapy for depression is through counseling, of course, and antidepressants. For psychosis, ganun ulit, psychotherapy and the antipsychotics. So it's very important to monitor the emotional status of a woman postpartum para ma-manage siya agad because this affects how the baby can care or how the mother can care for the baby. As a summary, do not forget the important acronym you need to assess a woman in the postpartum period. Check the breast, monitor, baka magkaroon ng mastitis, check the uterus, no? Baka magkaroon ng subinvolution, hemorrhage, either through atony o baka may cervical laceration. no? And also sa uterus, no, baka merong possible risk ng infection, endometritis, bowel and bladder, GI and urinary conditions that can also warrant infection, lochia, no, lalo na sa hemorrhage and infection, episiotomy, nandiyan na rin yung laceration, or kung CS man, yung wound o yung sugat, all can determine also risk of infection. Sa skin, no, yung hemorrhage, syempre, H is Homan sign, risk ng thrombophlebitis, and again, lahat ng yan ulit, no, especially mga bleeding conditions, baka magkaroon din ng DIC or other complications. And lastly, yung letter E, the emotional status. Watch out for risks ng blues, which may be normal, pero yung mismong komplikasyon, no, depression and psychosis. That's the end of the postpartum complications.